Hereditary Hemochromatosis, done by myself, Brianna Kugelmeister, and Jennifer Ponfil. What is hereditary hemochromatosis? An overview of hereditary hemochromatosis is it is a genetic disease, autosomal recessive disorder. This disease affects the HFE gene, and when a patient has hereditary hemochromatosis, the absorption of iron is affected in the GI system. And this disorder is most common in people of Caucasian descent. The genetics of hereditary hemochromatosis. Like stated previously, hereditary hemochromatosis affects the HFE gene. This gene is responsible for regulating a hormone called hepcidin, which controls iron levels. There are 4 types of hereditary hemochromatosis. Type 1 only affects Caucasians and is the most common genetic disorder in the white population. Other types 2, 3, 4 are much more rare and occur amongst populations worldwide. Majority of the forms of hereditary hemochromatosis are related to a disease of the hormone that we talked about earlier, hepcidin. When this hormone is decreased, it causes an increase of dietary iron absorption, then causing increased iron concentration in a person's bloodstream. Genetic prevalence of the disease. In the Caucasian population, about 11% of people are heterozygous for one of the mutations that cause the HFE gene disorder. In other populations, the percentage of people having this is significantly lower. HFE is an autosomal recessive trait, meaning a person is only at risk if they are homozygous or a compound heterozygous genotype. The penetrance of this mutation is pretty low, so people that carry the genotype for the disease do not always show the phenotype or characteristics of this disease. How hereditary hemochromatosis is diagnosed. Diagnosis generally comes with the onset of symptoms, and these symptoms usually do not occur until the person is around age 40 to 60 because the buildup of the iron in the system takes time and is a slow process. Typically, the first symptoms a person would experience are weakness, abdominal pain, and weight loss. Later symptoms occur if the person does not receive treatment or get an early diagnosis. And these late symptoms include liver cirrhosis, diabetes, bronze skin, cardiomyopathy, heart arrhythmias, arthritis, and hypogonadism. Women typically show later signs and symptoms due to the fact that they do have a monthly menstrual cycle, which the body is naturally getting rid of iron supply through the blood. So symptoms come after menopause. To test for the disease, there are several tests that can be performed. When it comes to diagnostic testing, they start with patients who are symptomatic and test serum iron levels in the blood. Because the iron level can be affected by diet, many times when doing this test, it is best to have the patient fast prior to. If the levels do come back elevated, the next step would be doing genetic testing to see if the patient has the disease. Carrier testing is done when there's a family history of the condition. A patient may not display the characteristics, but it is tested to find out if there is potential to pass a trait on to their offspring. And then these patients would have a heterogeneous genotype. And then predictive testing is done for patients with a family history who do not display symptoms yet, but could potentially have the disease. They are tested to see if they are homozygous or compound heterozygous genotype. If they do test positive, they can then have regular screenings and early treatment at the onset of the disease. Family history. It's important to gather a family history to determine the trends within a family and potentially gather enough information to find if we can gather an early diagnosis and then get treatment for the patient as soon as possible. When asking questions about family history of disease, take into account the patient's age. When patients are in to see you, if they are age 40 or less, the patient may be under the time when they would be experiencing symptoms. So it would be more important to gather a significant family history from them. If the patient is within the age of 40 to 60, asking them if they have had any symptoms would be important, and finding out if the patient is a female, if they have reached menopause. Knowing if the family members of either the maternal or paternal side have been diagnosed with hereditary hemochromatosis, or if they have had genetic testing done, is also important. And then stated previously, depending on age, asking about symptoms can help lead to a diagnosis. Nursing considerations. Education. Educating our patients is one of the biggest things that we can do as nurses. So when it comes to hereditary hemochromatosis, it's important to educate our patients on factors that can increase and decrease iron levels. Some factors that decrease include dietary habits, consuming a diet lower in iron. Factors that increase iron levels include iron supplements. It's advised to our patients to limit the use of multivitamins, especially ones containing iron, and meat products, alcohol usage, and excessive vitamin C. And also educating them that iron can be decreased by giving blood. It's also important to educate our patients on physical symptoms associated with iron buildup and toxicity. Some of these symptoms include fatigue, sexual dysfunction, including loss of sex drive, absence of menstrual cycle, shrinking testicles in males, joint damage, skin color changes, potential heart arrhythmias, potential diabetic complications, liver disease, damage to the adrenal, pituitary, and thyroid glands. And then it's also important to educate our patients on lab and diagnostic tests that they may experience frequently as a result of having hereditary hemochromatosis. And some of these tests are liver function tests, CBC, serum iron, plasma, ferritin, hemoglobin A1C, HFE mutation analysis, liver biopsies, MRIs, and then monitoring for psychological changes associated with having the chronic disease process. And then referring them to mental services for signs and symptoms associated with depression, informing physicians of symptoms of depression and recommending antidepressants as appropriate, and then educating our patients on treatment options that could include therapeutic phlebotomy, which is similar to blood donation, where the patient goes in and they draw blood from them to decrease the iron, serum iron in the blood. And then the iron chelation therapy, which can be oral or an injection. And then some legal and ethical considerations. It's always important to encourage our patients to seek out genetic counseling if there is a family history that indicates that there may be hereditary hemochromatosis in the family, or if a couple is starting to consider having children, having that testing done to determine if either of the parents carries that defective gene and potentially able to pass it on to their offspring. Maintaining HIPAA compliance at all times. So we want to make sure that we're obtaining permission from our patients prior to discussing the disease in front of family or friends, and also discussing genetic risks associated with the disorder. And these are our references. Thank you for watching.